I had been married for a very long time. I was a stay-at-home mom. I had given up my career. I was a corporate wife who had moved 8 times. When suddenly I started to be hit, there was a lot of confusion. There was a lot of fear. Nobody wants to tell their friends and family that they're being abused, but I knew that I needed help. By going to the Women's Center, it was just a whole different level of help that I hadn't received. They understood domestic violence.
Our mission is to serve the needs of individuals, families, and the community with crisis intervention, primary prevention, and education and support services throughout our 13-town area. No other nonprofit organization in the greater Danbury, greater New Milford areas offer the specialized services that we provide.
People come here in real distress, and they've either experienced domestic violence or sexual assault. Help them figure out, what are their resources, what are their support systems, what are their coping skills, what's working for them, what's gotten them through tough times in the past, help them connect with those support systems and move forward.
We are everywhere we need to be so that when that person reaches out, we are there 24/7, providing our free, confidential, and critically needed services. No other organization offers 2 24/7 hotlines.
It's a crisis hotline. We try to keep it short and to the point and try to help the person immediately. Some callers that maybe are just looking for some resources, some that just need a sympathetic voice, and then looking for shelter.
Our emergency shelter is a safe haven for victims and survivors of domestic violence and sexual assault. When someone calls our hotline and is in distress and it is determined that they are no longer in a safe environment and they and their children need to vacate, that's when we can pick them up or we can direct them to the shelter.
They get calls from every community. It doesn't matter if you're affluent, if you're not, if you're a business person, if you're blue collar, white collar, it just doesn't matter. They're there for everybody.
We typically need them at a moment's notice here within usually the 4 walls of the hospital or the ED. They're the prototypical example of a first-rate not-for-profit organization.
I firmly believe that an informed community is a safer community. So we are in all schools addressing children as young as pre-K through university level.
And our prevention educators focus on working with youth in the community, primarily through local schools, but also other youth organizations. So we really follow the public health model of prevention and instilling those protective factors such as healthy self-esteem, communication skills, conflict resolution. Our programs for younger students, pre-K through 1st or 2nd grade, we utilize puppets. Recently, we were invited into a school to provide this program because the school and family believed that a young boy had been victimized. After our program, the young boy expressed the desire to talk to his Sebastian puppet. At home, with the help of Sebastian, he was able to discuss with his parents the sexual abuse he endured, and he was then connected to the appropriate services for support. Because of our program, this child now had an understanding of what happened to him and was comfortable enough to disclose his abuse. We can still prevent sexual assault and sexual abuse, but do it in a way that's really age appropriate. When you're thinking about dating abuse with teens, you often don't think about technology being used to have control over a partner, but a lot of abusive partners are using technology to monitor or harass or control. We want to change perpetrators' behaviors, not just let victims know that there are services.
The programs have been very successful in terms of outreach and making connections with students. The students have a very, very positive sense of the Women's Center here.
We're here on campus. We are here to help students together with Western to make this a safer campus and to help students that are in crisis that need the help. And students are feeling more comfortable, not necessarily to report what happened, but to come and get help. And we really help victims move through the whole process of reporting or not reporting or getting help. The police always recommend the Women's Center, so that is part of their protocol.
Here at the Danbury Police Department, we use the Lethality Assessment Program, or LAP, in conjunction with the Women's Center of Danbury. A Lethality Assessment Program, or LAP, is a 11-question sheet that we ask victims of domestic violence. If they spot or answer yes to enough of the questions, then it triggers the protocol and we put them in contact with the Women's Center. That gets a follow-up because the people at the Women's Center then follow up with more employees at the court advocates.
Every time a new case comes to court that is considered family violence, the family violence victim advocate is given a referral, and we reach out to the victim and we explain the judicial process to them. We explain criminal prosecution, different programs that are available, how they can utilize the court, how they can get information from the court, and have their voice heard in the process. There really isn't anyone that we can't serve, and that is our obligation and duty to serve every victim of family violence in Connecticut.
Because the center isn't one thing. It isn't domestic violence help. It isn't sexual assault help. It isn't just education. It's all these things to empower people to, have a sense of themselves, their own dignity, to believe in themselves, to have the strength to leave a bad situation, to turn something around, to seek out the kind of support they need. I think that the programs that the Women's Center offers all come down to empowering people.
Together, we serve nearly 26,000 people every year in our 13 communities. Together, we all help the Women's Center sustain its professional services and prevention programs, all free of charge, 24 hours a day, 7 days a week, for all who turn to us for help. We're all working together to end the violence and make our communities safer for the next generation.